completely normal. In fact, only about 40% of infected rams get lesions in their epididymis below their testes or above their testes. So quite a few show no signs. You can have epididymitis, which is a lump. That's the bit of the lump below the testy. That can get very swollen, and that can occur in either one testy, in which case the ram's likely still to be fertile. Mind you, it's only firing on one cylinder, not on two. So if you're running a good show and joining at a reasonably low ram percentage, particularly because rams are quite expensive at the moment, you might be stretching your ram power, and one of those testes isn't working, then you might be losing fertility. And if both testes are affected, which can occur, then the ram is likely to be infertile. So I haven't got any good pictures of rams. I've got lots of pictures of other sheep, but not of rams. So have to excuse my pictures tonight. The other thing to think about is, when does transmission occur? And we often forget that rams, like ewes, are seasonal breeders. And that's most pronounced in some of the British breed, the Border Leicester sheep in particular. But even the Merinos are more active over the summer, autumn period, and less active over the winter and early to mid-spring period. But transmission can occur all year round. It's just the rate of transmission will occur more frequently when there's a lot of sexual activity occurring, which will be in that summer, autumn period. So if you're going to eradicate brucellosis, it's best to do that from your ram team during the winter and spring post-mating. Trying to eradicate it, if you detect it just before you put rams out, trying to get rid of it that time can be quite difficult, and it can also disrupt what you're trying to do in terms of mating. And that's one of the messages I'd like to give tonight is, if you have got brucellosis in your flock, there's no need to panic. There's just a matter of sorting out a sensible approach to what's the best way of getting rid of it, which I'll come on to in a minute. It is often identified pre-joining when people do their pre-mating check, and they suddenly find when they're palpating the ram's testes that there are some abnormal bumps on it, lumps. It's not the only thing that causes lumps, but if you've got a number of mature rams with epididymitis, there'll be a very strong chance that brucellosis is present in the flock. And as I mentioned, rams seroconvert in 10 to 14 days after exposure. We're all experts now on diseases thanks to COVID-19. It's been free tutorials every night of the year in 2020, one of the great things that happened in 2020. So we're now all experts, and it's actually exactly the same in terms of what's happened with COVID-19. Getting a negative test only tells you that you were negative then. It doesn't tell you that you don't have the disease. So if you test a ram and it was exposed 7 days earlier, it will be negative on the test even though it's infected. And so it's all about understanding the timing of the test. So most accreditation programs in all the states require you actually to have 2 tests for the rams before you become accredited free of the disease, just in case the first test occurred while animals were incubating the disease. Clearly, if there hasn't been any introductions or exposure to other animals for a long period of time, that may be a little bit of an added precaution or an unnecessary added precaution, but that's one of the rules that they have. There have been reports certainly up to 43 days, and there is one report up to 66 days, and I'm sure that individual animals, just like individual people, can take a while to convert. But Karen Bailey did some excellent work where she infected rams back in the 80s with different doses of brucellosis culture, and she showed that, like as you'd expect with all disease, it's dose related. How quickly they seroconvert and how quickly they start shedding disease. So it also depends on how infective the particular rams are. And that's normal in the biology system. There's no such single number that always works. So having heard a bit about brucellosis, you need to think about, do you know your flock status. Do you know the status, the brucellosis status of your rams? And there's two ways of finding out. One is you can blood test the rams. The other thing you can do is palpate the rams. And if you palpate your rams every year and there are no rams with any abnormalities in them, it's most unlikely that brucellosis is present in your flock. Obviously, if you're a stud and you want to market your animals as brucellosis free, which I'm sure most studs do, then you need to go through a formal program. If you're not a stud and you're a commercial flock, then you can certainly go into the program, but the value of it is going to be less. What you really want to know is that you don't have it in your flock, and then you want to make sure that you only introduce rams from brucellosis free flocks, and you will remain free. It doesn't drop out of the air. It obviously does come through if you get a stray ram from the neighbours, but you're going to get lice and a few other things possibly with that as well, so that will be a warning as well. But if you don't have it in your flock and you're introducing free rams, you will remain free from brucellosis. So they're the two things you can do, and the obvious thing is that if it's present in your flock, buying brucellosis-free rams doesn't give you any security whatsoever. There is no vaccine available for brucellosis in Australia. So if a ram comes from a free flock and it gets exposed, it's just as likely to get the disease as any other ram. So it's important to understand that coming from a free flock doesn't provide any level of protection to that ram. It just means that ram won't introduce the disease into your flock. So I think either palpation or testing or a combination of them. If you find, for example, if you find an individual ram with a lump, you can get that tested, and if it's negative for brucellosis, that'll give you a fair level of assurance that you've targeted the most likely animal. You don't necessarily need to bleed all the rams to establish what the likely status is. I'm now talking not on accreditation level, I'm talking just at the flock level. I'm happy to answer any questions on accreditation. I haven't done that tonight because I'm thinking if you're running a stud and you're listening to this, you probably already know about it. And if but I'm happy to answer any questions on accreditation. So what happens if you find brucellosis in your flock? And the first thing is, don't panic. It's not like lice or foot rot where it's out of control and it's going to cost you lots of money and it's difficult to deal with. The title of this actually mentioned the word treatment. There isn't a treatment. We don't treat animals with brucellosis, but there is a very, very good strategy, and that is which we've just heard about for the last 12 months, and it's called self-isolation. And if you can actually run two ram flocks on your farm. You can run a clean and you can run infected flock for a period of 2 or 3 years as you go through and eliminate the rams without having to just get rid of them the moment you find you have a problem. Again, I'm not talking in the stud situation, I'm talking in the commercial situation where this is most useful. Usually in a stud situation, you want to get rid of it immediately so that you're able to sell your sale rams as accredited. So there's the possibility to run different flocks, and if you're doing that, you can obviously the simplest thing is to bleed those animals, but you can also palpate them, knowing that palpation gives you a pretty good idea of the likely impact on fertility. There is an estimate that you need about 10 to 20% of rams with epididymitis to start to get an effect on fertility, but it all depends on I think it's meaningless to try and work those sort of figures out because it depends on what ram power and in particular what testicular power you're using in your joining, because that's what joining is all about, is how many grams of testes and how much semen is being produced across the number of ewes being joined. You certainly, I would encourage anyone who has brucellosis in their flock to think about getting rid of it. It is reasonably straightforward to get rid of it. And over time, that will be the best thing, but it certainly doesn't need to be done the moment you detect it. It's not an emergency situation. Hope I've made that clear. I've just put up some eradication tips. The bits in writing, these are just some tips I passed on to a vet who contacted me recently, just looking for tips on how to eradicate Brucella rovers from a flock that the vet was dealing with. And I just thought I would share these with you. If the very first thing is that most spread occurs when rams mate another ram. If a ram is uninfected, it can't, and it's not out with the ewes, it can't get infected unless another ram mates it. So if you have 50 rams on your farm and they're all in separate paddocks during the non-mating period, the status of those rams would not change during the year. If one was free, it would remain free because it couldn't get infected. If one was infected, it would remain infected, but it wouldn't spread the disease to any other ram because it wasn't in contact with any other rams. Obviously, putting a ram in every paddock might be nonsensical, but understanding that the more that you can segregate groups of animals, the less spread that will occur between them. And it's very important in a eradication program or a control program that when you identify animals that you think are likely clean, if you split them up into more paddocks, the chances are they're much more likely to stay clean because by chance they won't have an infected animal with them. The other thing is that we commonly run what's called the complement fixation test. There is a second, more sensitive test, the ELISA test, which we don't run routinely. But if your vet has collected samples from your animals and they detect that some of the animals are positive in the complement fixation test, I would always recommend that you ask the vet to get the negative samples, the ones that have come up negative with complement fixation test, run with an ELISA test so that you can, you just get if you're trying to get rid of it, it's better chance of identifying every infected animal. The reason we don't use the ELISA test is increased sensitivity isn't always the be-all and the end-all, but if you're trying to get rid of it, it can be a useful step. The other thing, and I've pinched some from Jacinda Arden here, the hard and fast approach that the Kiwis and now some of the Australian states are taking in terms of COVID is really relevant. The critical thing is that if you are trying to get rid of it, that you do a couple of tests very quickly. You don't sit back and wait. If you wait, as people often do, and they say, oh, I only have to test every couple of months, the disease can be spreading. Remember that the animals will seroconvert, usually, not every one of them, but usually by 10 to 14 days after infection. And they start shedding anywhere from 21 days is about the earliest we've detected Brucella rovers shedding, and we say generally 4 to 6 weeks. So you've got a window there of around about 8 days, potentially 14 days, where the animal is positive on a blood test and it can't yet infect other animals. If you can identify and isolate that animal away from clean animals, then you won't have any more transmission. So it's pretty important to go in and do a couple of tests very quickly if you're trying to get rid of it. And irrespective of what you do, when you get the tests back, you need to isolate any positive rams into a group. Obviously, putting positive with positives is fine, but they must be segregated immediately you get the test. And the test usually will come back within 48 hours of the blood being taken. The other thing, which is teaching everyone how to suck eggs, is if you are doing anything on eradication, make sure you have very good identification on the rams and make sure that people read the numbers properly. I've had a couple of instances where programs have gone astray, and when we've investigated, embarrassingly, it's been the wrong ram was culled and an infected ram stayed in, and a uninfected ram actually got culled because the tag ID wasn't clear at the time that the blood was taken. And as I mentioned, winter and spring is the best time to be going through some sort of eradication program. So that is I'm happy to talk about economics, but it really depends on each individual person as to what they're paying for rams, what ram power. So I could have given an example, but it would be meaningless to everyone else. So I'm really keen to answer questions, because I'm not sure what's difficult about this, but it clearly is, because we continually get questions about it. So fire in. Hopefully that's not too brief, Hillary.
No, that's fine. Thanks, Bruce. We haven't got any questions in yet, but I'll just give Bruce a bit of a break and those who are on the webinar to get their questions ready and sent in. Just to remind you, these webinars are recorded and are available at a later date on the MLA website. If you do have to head off quickly, please take your time to do the survey that pops up at the end of the webinar. It just provides feedback for MLA presenters like Bruce and ourselves at Aggregate Consulting to make sure that as a participant of the webinar that you are satisfied and we are delivering relevant topics. All right, so still no questions come in. I have one, Bruce. Do you still see, so I guess, is there still a high proportion of flocks that you treat? Would you say it's very prevalent ovine brucellosis, or not as much, or in the cases that you see?
Yeah, look, it's hard for any individual vets to really get a good picture of what.
Oh, sorry, Bruce, you just dropped out for 2 seconds there. If you just want to start again.
Right. Am I back on again now?
Yep.
Yep. It's hard to know exactly what the prevalence is out there. And as far as I'm aware, that there's no surveys. It's one of the diseases that we list that merinos are less susceptible, and we think that's because they're generally less that they are less sexually active than the British breed sheep. And a lot of spread occurs very quickly, particularly in British breed sheep. So we tend to see it more in those, and there's been a bigger awareness of it in the British breed and terminal sire type industry, but we certainly see it in all flocks, all types of flocks. But I'd be interested whether people think they've just had a problem or they've had it for a while.
All right, thanks, Bruce. Questions come in. If rams are still in with the ewes 1 month after lambing, would it be likely the new ram lambs on the ewes could be infected? If that makes sense.
So the rams are out with the ewe flock while they're lambing?
Yes.
Seriously? Yeah, okay. No, look, not with the rams at 1 month of age. I mean, those rams won't be sexually active, and I don't think the adult rams would be mating the young rams at that stage, the lambs. I don't think the lambs would be big enough. There's got to be sexual interaction between rams to get transmission. So it's when that occurs, but that would be a very, very unusual situation, I would have thought.
All right.
I'm not sure why rams would be. I mean, the ewes aren't going to be cycling. I'm not sure why the rams would be out. I guess if somebody's got an all year round lambing type setup, but that doesn't usually go very well. Even with 3 lambings in 2 years, you still don't have the rams out while they're actually being mated.
All right.
But the answer is simple. The answer is that any time there's sexual activity between animals, then an infected animal can result in an uninfected animal becoming infected. And it actually highlights a really good point, that if you're buying in new rams that you know are clean, and this is one of the simplest ways of getting a clean flock, in fact, without doing any testing at all, and that is buying from an accredited free flock and keeping those rams separate to your own ram team or the older rams, and joining them separately to separate ewes. And over time, you accumulate all the purchased rams into one mob, and the older rams eventually get culled, and you've got a clean flock over 3 or 4 years, depending on what your strategy is. So it's just a matter of thinking about what's going on there, and knowing that that's how transmission occurs.
Okay, thanks, Bruce, and thank you for the question. The next one, hello, Bruce. For eradication, your recommendation was blood testing every 8 days until 2 negative tests, and then again 60 plus days later. Is that correct?
Not quite correct. So what the first 2 tests I recommend 8 days apart. After that, it depends on what the exposure has been and what the level is. You can often take it out a bit further at that second test. It just depends on, but the first 2 tests I recommend 8 days apart, because that guarantees that you've picked up any rams that were incubating in that period before they've had any chance of shedding. Certainly within 14 days is essential. People often leave it a month and get away with it because they're doing it in June or July and the rams aren't very sexually active. But the best practice is to get in and do 2 tests 8 days apart. And then have a look and see what you've found. Now, if you're still getting a lot of disease at that stage, I'd be doing another test 8 days later. If you haven't had much transmission at all, then I'd be relaxing that and leaving it a little bit longer. If you want to go for accreditation, then you need to have 2 negative tests at least 60 days apart. That's for New South Wales and Victoria. I think WA might be the same. One of the states has got a slightly different one. As states have a habit of doing, they all have slightly different rules from the same information, but I won't get into the politics of that. So check, if I'm just wanting you to check with each state has its own program on these, so you have to comply with the state program if you're wanting accreditation.
Great, thank you. Thank you for the question. So another one, if all ram studs or supplies were accredited and negative for brucellosis, in theory, would it be eradicated completely?
No. And therein lies the problem, because it's not a problem for the studs. It's a problem for the commercial flocks. So selling free brucella-free sheep into an infected flock just makes them become infected over time. So the way, if we wanted to eradicate it, then everyone with, which is why we haven't bothered to eradicate it, is because everyone with any rams would have had to have their rams tested, because the only thing that the stud people can rightly do is make sure that they're selling free animals to people, and if people have free flocks, they won't be getting the disease. But if the disease is already present in a commercial flock, and it's in lots of commercial flocks, then that's where the problem occurs. Does that make sense?
Yep, it does to me, but let us know if you need some more clarification from that person who asked the question. Okay, a final one. So get your questions in if you haven't already. The last question I've got here, Bruce, is could a vaccine be useful in eradication if we had one for rams?
Vaccination is useful for controlling the disease. It's not really necessary in eradication because we have all the tools. The tools we have is we have a highly effective, reasonably cheap. I think it costs, I mean, the most expensive thing is actually getting the blood, but the test itself is reasonably cheap and robust. We've got the tools to eradicate it, and vaccination wouldn't help with that. What vaccination would help with is you wouldn't need to worry about eradication. You just vaccinate the animals, and then the effects of the disease wouldn't be seen even if it was present. So that's the only role of vaccine. But given the fact that it's reasonably easy to control in any case, it's not a high priority for a vaccine. So there is a vaccine available overseas for Brucella ovis, but we don't have it here, and I can't see it ever being warranted in Australia. Given that we can control this a number of ways very simply just by segregating animals, and palpation alone is quite good at in commercial flocks at making sure that fertility is going to be affected, and ram flocks, stud flocks can certainly, blood test, and most of them, my understanding is most of them are accredited.
Excellent, thank you.
Accredited free.
We have had a few more come in, Bruce. So one The first question is, if ewes are joined to infected rams, what is the minimum time to wait before mating ewes with clean rams?
That's a great question. So the answer is I'm not sure. I would say, from everything I understand, if you mate with an infected ram in that season, you shouldn't be mating with a clean ram if you want to keep the ram clean in that same season. So I'm talking about a year. It doesn't. It's if the ewe gets infected, we believe that she remains infected for possibly 3 to 4 weeks, and then she normally gets rid of that disease. But if in some cases they might go on and actually abort, and presumably there would still be infected material around there. But if they get pregnant, they're unlikely to accept a ram. So the risk, it sort of gets very complicated. And most joinings we would expect, and I haven't talked about my pet hobby horse tonight. I should have thrown it in there, Hilary, but we'd like to see joining for a very short period of time. And generally that joining should be less than 5 to 6 weeks, 6 weeks maximum, 5 weeks for those joining in the middle of the autumn, 6 weeks if you're joining a bit earlier. And it's that sort of period that they might remain infected. So you wouldn't be using the ram in the same season. I hope that makes that clear.
Yep, and we've had a few other questions to the same effect, so let me know if you want more clarification.
They're absolutely great questions. I love these questions.
So the next one, Bruce, are false positive CFTs a big problem?
Yes, so we've got a false positive and a false negative. The reason we use the CFT is it has a very low false positive rate. So that doesn't mean it's zero. We do not have any test that I'm aware of that is 100% sensitive and 100% specific. It's the specificity that determines the false positives. And my understanding is that it's about 1 in probably 500. It might be 1 in 200, but it's a pretty low rate, and it's not too much of a problem. It is a headache when you've got a free flock and you come up with a positive ram. Most vets are very good at sorting this out, in that the CFT test, the first reading you get is 4, and then it goes in multiples of 2 after that. So it goes 4, 8, 16, 32, 64, so on up to 256. Now, I can tell you, if you get a 256, I'd almost guarantee it's not going to be a false positive. The false positives we get are around the 16 and possibly 32. 8 is not considered positive, and even 16 is not really considered positive. It's a suspicious, and it creates a bit of an issue. But it's a matter of, if you've got one animal and you out of 50 that's got a positive reaction, then it will be classified, and it's only a 16, then you won't be a problem. Equally, if you do have brucella, and it's why the CFT is such a useful test, if you do have brucella ovis in your flock, you don't muck around with animals. Even an animal with an 8, I would be culling, even though in another flock we might be saying, well, that's not even necessarily infected. Once you've got infection there, then usually the CFT will show those animals, and that's what you're looking for. But in negative flocks, you can always get the odd animal that will have a low positive reaction to the CFT, and that's really frustrating. And a couple of these rams we've literally, I shouldn't say this on air probably, but pulled apart. No. And we haven't been able to find anything. And obviously, if it's a valuable ram, that's pretty expensive exercise. So, yeah, appreciate they're a problem, but that's why we use CFT. It has a very low false positive rate, fortunately.
Great, thank you. And then the final question, unless there are any more to come in, can teaser rams spread the disease?
Yeah, great question. Yes, teaser rams can spread the disease if they are actually rams that have been vasectomized, not if they're teaser wethers, I presume. Teaser wethers can't spread the disease, but teaser rams can spread the disease because they have everything there that will make semen and will store it and can be shed in the semen. And in fact, when you go to accredit a flock, you need to look at all rams and teaser rams are part of the animals that have to be tested because they can spread it. So absolutely. So if obviously palpating teaser rams is fraught with difficulty, but if you've got evidence of epididymitis, I call them lumps and bumps. It's not very scientific, is it? But epididymitis is such a big word and it doesn't really mean a lot to people. If you've got these a large lump at the base of the testes rather than the small firm nodule that you normally have, the epididymis, and you've got that in a number of your rams, and you've got some teaser rams about, they need to be blood tested as well if you want to get rid of it. Great question.
Good one, and we love basic terms on these webinars, so thank you, Bruce. All right, that's it for this evening, and thank you everyone so much for getting your questions in. I hope that cleared up any doubts or any questions you had, I guess, on ovine brucellosis, and thank you very much to Bruce for presenting on the webinar. Just before you go, we do have a final webinar for 2020 in a fortnight's time, presented by Tom Keogh on maximising lamb growth pre and post weaning, and I believe Bruce is jumping on for that webinar as well for any questions after the presentation.
Yeah,
Sorry, Bruce.
I'm just there as support if there's any animal health things. Tom's the real deal on all the nutritional side of things, but he was just concerned that somebody might have a tricky animal health question. So I assured him I'd be there listening and would jump in if needed. But he's right on. He's done some really good work on his PhD, so that's exciting.
Yeah, no, I look forward to it, and Tom is definitely very capable, so it'll be a great presentation. We hope you can join us in a fortnight's time. So thank you very much again, Bruce, for presenting this evening, and thanks everyone for jumping on. We'll see you soon.
Pleasure. See you, Hillary.
Bye, Bruce. Thank you.